Hi, and welcome to episode 200 of the Untethered Podcast. It is your host, Hallie Vulcan, and we are going to dive into a very brief episode today together on tethered oral tissues. It's just me and you, so let's jump in. And yay, happy 200 episodes to the Untethered Podcast. Let's do this thing. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered Podcast. I am your host, Hallie Vulcan. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. There's been a lot of discussion on social media and amongst different professionals about tongue ties and lip ties and the research or the lack of research. And so I just want to lay it all out there and have a very informative but short episode on what we need to be looking at, what we need to be doing, and the key things to remember when it comes to assessing, diagnosing tethered oral tissues and making referrals, or if you're a parent, knowing what questions to ask, knowing who to trust, who to listen to, right? So hopefully arming you with this information is going to help you figure out who to go seek or what next questions to ask. All right, so let's jump right on in because we only have a few minutes. So I put up a post on Instagram last week that said something along the lines of like, let 2023 be the year that large SLP accounts with like 80,000 plus followers and, other medical providers providing information, all of that fun stuff, like people with large following, let it be the year that they put their ego aside, have healthy conversations with colleagues instead of blocking them, and listen to patients and caregivers over a lack of research, okay? Because we need to put patients first. I just wanted to put that out there. The next thing I want to highlight is that I want this to be the year that we remember the diagnosis, the definition of the diagnosis of a tongue tie. Or definition of a tongue tie, a lip tie, a cheek tie, right? There has to be a functional impact. It's not enough that the tissue presents as being quote unquote tight or short or restricted. Is that important, and should we monitor it if there are no symptoms present? Absolutely. But a tie is not a tie, whether it's cheek, lip, or tongue, unless there's functional impact. And what do I mean by functional impact? I mean, feeding is impacted. Sleep is impacted. Maybe down the line, we see kids who've been in speech forever because they don't have full range of motion and can't actually hit certain sound targets. So it impacts their speech. Behavior, because their sleep is impacted, right? We start to see these snowballing issues, right? Airway issues, always getting sick, all these issues that tie back to what's going on inside the mouth. But we have to remember, and I'm sharing this, we have to remember the functional impact and what that means, because I still see a lot of professionals, and parents, and I can't blame a parent, but a professional who's taken courses and who admittedly says they know how to assess and diagnose a tongue tie, but then spreads misinformation. We need to make sure that we are imparting the correct information and empowering parents. And so I see a lot of parents saying things like, oh, well, my child was diagnosed with a tie, but we didn't do the release. And my baby, was totally fine with feeding and speech and, sleep and all the things, right? And they still are fine. Well, then it's not a tie. If there's no functional impact, there's no impact on their overall health. We're not seeing systemic snowballing of issues and signs and symptoms that are, impacting their ability to function every day and their optimal health, then it's not a tie. It's just a typical frenum or, frenulum, if that's what you want to call it, right? Our frena, our tissues, those oral tissues exist. Everybody should have them. It comes down to how pliable are they? How stretchy are they? Do you have full range of motion? Is there any restriction? And then beyond that, what is the functional impact? That is the question we need to be asking. And if we cannot answer that, or we don't see a functional impact, or we don't have the education to know how to answer that, that's when we seek out an evaluation, right? And with an evaluation, and this is where I also said, like, let's let this be the year that speech language pathologists and occupational therapists, and then PTs who may be trained in this as well, because we are the only providers who have
feeding and swallowing beyond like breastfeeding in our scope of practice and covered by our licensure. We are the only people who can actually do a functional feeding, sensory oral motor feeding evaluation. Under the age of 4, that is what is needed. Can we still do it after 4? Absolutely. But after 4, if you're starting to see airway issues and tongue-tie concerns, I mean, there's malocclusion, right? There's issues with the jaw or the TMJ or airway, right? That may look more like an orofacial myofunctional evaluation, which for SLPs and OTs and PTs is kind of an extension of what we're already doing in our assessments if we're trained to look at airway and tethered oral tissues and, the orofacial complex in the way that myofunctional therapists are. SLP OT, PT myotherapists are. So over the age of 4, you can go to a general myofunctional therapist if the child has the cognitive capabilities of at least a 4-year-old. Some children need to be a little bit older because there is this active engagement in a myo-eval and in myotherapy that requires the child to understand what they're asking them to do in order for us to, or adult, in order for us to get the most accurate information. So that's really what I wanted to plug. There's one other thing I want to say today. I was recording an episode with a colleague and we were talking about, she said, she's a pediatric dentist who does tethered oral tissue releases. And she said to me, we really need to, be not just encouraging, but requiring that children have pre-op and post-op therapy. And we need to, another colleague said to me this week, we need to condition the muscle groups, right? We need to condition basically the oral structures, the soft tissue before the release. So it's prepared. And then we need to get in there and we need to continue therapy after. And so anybody who is going for a release without proper oral motor intervention or orofacial myofunctional intervention, that's not a provider you should be seeing, because that is, in my opinion, even if you get a good release, the function in most cases is not there. Will some children maybe gain the function afterwards? Maybe. Have we seen children improve drastically after release? We have. But most people need the surrounding support. And it's my professional opinion that a lot of these procedures are happening without proper care surrounding them. And I'm not talking just body work. We need to be working in the mouth. We need to be teaching the tongue proper function. And we need to realize that when a tongue is released, right, it's now free, quote unquote, but it's not going to change how it functions if it's not trained. We need that neuromuscular re-education, or as my colleague Karen said, we need to condition the muscle group. Okay, her episode will be coming out in a few weeks. We need to condition the muscle group. So what does that look like? That is that pre-op and post-op therapy that we talk about. And one of the things I put on my post was like, let this also be the year that more providers collaborate with the patients and also require the therapy surrounding tethered oral tissue releases, because so many of the comments that I see over failed releases or issues that evolved after the release, when you ask and you have a conversation with these individuals, they tell you, oh, no one told me I needed pre and post-op, or they told me, but they didn't require it, so I didn't do it. Or, we didn't have the money to do that. Well, in some cases, it can be actually detrimental to have a release and leave out the supports that you need to make that release successful, right? So that's what I kind of want to wrap this up on. Like I said, today is a very short and sweet episode because this is a very important message. The other thing I want parents and providers to be aware of is that we cannot just fall back on the lack of research or cite things that serve our purpose when it endangers the public. We are seeing that when patients have proper support with a skilled release provider and they have that pre-op and post-op therapy, is what I mean by proper support, right? We do see the benefits. Sometimes they're more immediate, sometimes they take longer, but that is part of the therapeutic process. There is this dance between what we do. I joke, it's like a dance between an art and a science. And we have to be critical thinkers as professionals. We have to put our critical thinking hat on. We have to go, okay, what does this patient in front of us need today, right? Who is this patient? What do they need? How can I help them? What are their goals? What are their next steps beyond just what I'm recommending? What does that parent desire for their child? What does that adult patient need for themselves, right? And so with that, as we start to wrap this up, we need to realize that the research is lacking. There is some good research, there's more coming out, but the research is also lacking. There's also a 17-year lag in research, and you can look this up. This is documented. It's across all areas of medicine. It's also true that all areas of medicine have certain areas that are lacking in research. It's also true in the tongue-tie space that individuals who have tried to publish research or do research have been blocked by boards, some boards that they sit on, because these boards of individual as a collective whole, that individual maybe aside, do not agree. They don't believe that tethered oral tissues are an issue, so they block the research from being done. So the point of me sharing this is we need to keep these things in mind, okay? There is a lot of red tape behind the scenes. And at the end of the day, our patients come first. Our experience needs to be pulled into this. And when the research is there to discuss both sides of a situation, then we can have a better balanced conversation around it. But we have a due diligence, we have an ethical responsibility, and we have a licensure to uphold that requires us to present all sides of the information and make sure that our patients have informed consent. And that also falls on individuals when posting on social media, which is why I always say, we need to do a functional evaluation to determine next steps, determine if the tie needs to be released or not. The last thing I will say as I wrap this up is just because a patient has a tie or presents with a tie and has symptoms on a functional evaluation, it doesn't mean that they need a release, right? When you start feeding therapy or myofunctional therapy, we sometimes realize within 2 to 3 weeks that the tongue appeared to be tense, the tongue appeared to be tied, the lip appeared to be tied because of the surrounding tension that was mimicking a tie, right? Or maybe there's not enough space for the tongue to live in the palate, and it's actually a tongue space issue, not a tongue tie issue. There are other things that individuals in this space are trained to assess for. So no, not everybody who walks in the door goes for a release, and not everybody who gets diagnosed with a tethered oral tissue, a tie, whether it be tongue, lip, buccal, not everybody ends up needing a release or getting released. Sometimes things look different even just 2 to 3 weeks or a month later. So please, next steps, if you're a parent, seek out a provider that, as I've explained, for a functional assessment based on your child's age, right? Under the age of 4, you want an OT, SLP, or PT trained in pediatric feeding, myo, and tethered oral tissues, and airway ultimately. Over the age of 4, a orofacial myofunctional evaluation can be appropriate versus, having to see one of those specific providers, SLP, OT, PT. Professionals, if you want to work with birth to 3 and you want information on TOTS and how TOTS and airway, myo, and all that impacts the birth to 3 population, and how you as an SLP or OT, can work with these patients, then come join me in Feed the Peds. Go to feedthepeds.com. I'm going to plug that here real quick because we need more of you. We have over 1,500 of you that have gone through the course in the past couple of years, but we need more. And our patients are constantly, not our patients, parents are constantly asking for more providers. So join me in this mission. Go to feedthepeds.com and join us this week because doors are open right now and they close on Friday. I cannot wait to see you all inside if you're joining us. If you're not, if you're a parent, if you're a provider who wants to learn more, just check out more episodes of this podcast. Join me at Hallie Balkan on Instagram. There's tons of free information for you, and I look forward to hanging out with you over there. All right, everybody, we'll chat soon.
Thanks for listening to this podcast. If you want to hear more of these myo, TOTS, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Balkan Biz, on Instagram at Hallie Balkan, and you can head over to the untetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.